Hello, this is Dr. Shaw Rice with Shaw Medical Travel Consultants, and we're welcoming you back to another one of our interviews. Today we're interviewing Liliana Aguilar, who is a nutritionist in the Houston, Texas area, and she's going to provide some valuable information about nutrition, travel, and wellness. So before further ado, I'm going to allow Liliana to give us a little history about herself. Liliana?
Yes, my name is Liliana. I'm a dietitian nutritionist here in Houston, Texas, as Dr. Judy just said. I've been, in this career for probably 20 plus years, and I have, by referral, seen patients and also have worked at different clinics and mostly seen, the different communities, different Hispanic, Cuban, Central American, South American, as well as American also. So I've had a variety, cultural connection with the nutrition and cultures.
Excellent. Thank you so much, Liliana. So let's just start off with how you approach dietary needs or dietary restrictions amongst different cultural backgrounds, patients from different cultures. How do you approach that?
Well, first, you know how it has changed quite a bit, because in the past, we didn't have all the technology. So different cultures now connect with the technology and the travel. So actually eating habits has changed quite a bit, unless they're more isolated communities just throughout the world, because we're more exposed. But even though that is happening, they still have their own cultural and ethnic foods. So I try to connect with those in a sense, because a lot of times some patients will say, can you write a menu for me? And I really don't like to do that, because what they're going to eat long term is not what I write down for them. So I like to connect as to what kind of foods they are used to, what kind of foods they like to eat, obviously modifying it to be healthier, so they could do it long term, and just instead of just a month or 2 months just to lose weight, or maybe get their lab values down and go back to eating the same, and then we have the same problem.
It's really a lifestyle change.
Yes, long term. That's very important for me for my patient to achieve.
Mm-hmm. And so, in this day and age, in our health environment, we talk a lot about social determinants of health, and we are attempting to match the needs of the patient to their objectives in health and their perception of wellness. As you know, depending on the cultures that people come from and what their cultural background is, their perception of wellness differs. And wellness doesn't necessarily mean the absence of medical diseases. So where you go to from your point of not feeling so healthy to your point of feeling healthy, point of feeling well, can differ between individuals, and even within those individuals can differ from the cultural variation, regions where people live. All that can impact your perception of wellness. And of course, food insecurity and eating well, eating healthily is a part of that as well. We also know, unfortunately, that healthy foods tend to be more expensive sometimes than unhealthier foods. At least that's the perception. So the question for you is, within that paradigm of variability of culture, where people live, what country they live in, or maybe they are all in the same country but different parts of the country, how do you adjust your recommendations from an eating well and an eating healthy standpoint to these individuals?
First, I try to make sure that they have an understanding what wellness is. Not just absence of disease, but a state of living a healthy lifestyle. And that could encompass many things, and include many different things. Just also, wellness could be encompasses emotional, spiritual, intellectual, and so it also encompasses being, exercising, not just exactly just what you eat. So that's really important. So I try to see what the person is doing, and obviously maybe a first or second generation would be different from someone that's been here 5, 6 generations. And
Yeah.
they probably have changed their ethnic foods a little bit, if they're like, I mean, a lot, if they're like 5th and 6th generation, and have adopted more of the foods of, let's say, Texas or Florida or wherever they are, because in Florida they'd be a lot more Cuban descent, people that would eat a little differently from maybe Texas, where there's more people from Central America and Mexico. So I try to make sure that I understand what their ethnic background is, if they understand what wellness is to them. Is it just absence of disease? If that is healthy, also definition of healthy, absence of disease, and what their meaning, what they bring to the table as far as their health. Also, what their parents, what they ate possibly, and if they're here, and their disease states. If their parents, a lot of times I come across families where the parents or grandparents were very healthy. Well, they didn't have any problems because they lived out in the country in, let's say, Mexico, and they ate very healthy just off their farms. But when the children came here, and they had a lot more disease states. So trying to understand, okay, so then maybe this family eats more, McDonald's eats more of the, as they say, junk food, more fast food. So trying to see where I could help them modify that.
Yeah, like that. And so, if, for example, a lot of times in practice, clinicians practicing, and somebody who has diabetes, for example, and a lot of times physicians will just give them a sheet of paper and say, okay, here, follow this diet, 15-calorie diet, 100-calorie diet, 1800, whatever. Some sort of an ADA, American
Correct.
Association diet, and say, okay, go follow this. What's your experience with that and the success rate of that kind of approach?
Right. I think the success rate of doctors just give them a sheet of paper is very low. But if they're sent to someone that it can explain, because a lot of times I'll get patients that they were given a sheet, but they didn't even understand what diabetes really was. They kind of were given medicine and they didn't have a grasp of what diabetes could do to them. And a lot of them also believe they take their medicine and they can eat whatever they want and they'll be fine. So I have to explain to them that the medication is basically like a Band-Aid, but you have to change your eating habits. And a lot of times, implement with that the exercise and supplements to help them, because there are supplements that definitely do help a lot. And how that you can connect and use all of that to better your health. And try to actually bring down their lab results as far as the hemoglobin A1C and so forth. But it would be first for their understanding, because I see that a lot of times they just think that the medication and that's the answer, but they don't change anything else.
Yeah, okay. So a couple of other things want to change our focus a little bit here with regards to traveling. How do you suggest, or what do you suggest individuals do to comply with their recommended dietary restrictions or dietary needs while they're traveling? As you know, of course, now with COVID, not too many people are traveling for leisure, but there's a lot of commercial travel. There's traveling for business and necessary travel that still goes on. And in some countries and in some regions, there is a personal travel that still being still going on. And even if it's not travel to a different country, even getting in a car and going to a different state, you know, you need to find whatever it is that you need to eat, particularly if you're from a certain ethnic cultural background, and maybe wherever you're going, not too many folks uh, from your cultural background are, and then so that's a little difficulty for you. At least that's what you're accustomed to. Um, Even within the paradigm of the recommended diet, you still try to stick to what you know, oftentimes. So, what do you suggest? Do you suggest, I mean, do the clinicians generally know? My experience is usually they don't. And yeah, well, how do you suggest someone take care of that so that they're, since we're talking about diabetes, could be any medical condition for that matter, doesn't go kaput uh, on their.
Right. I guess it would depend on their restrictions. If they're major restrictions like dialysis or some diabetes, but if it's more, let's say, religious, Jewish, for example, then if they're anyone really traveling internationally can either first, if they want to check with their clinician, or if it's, like I said, serious restrictions, maybe a dietitian. If not, also look online beforehand. Where are they going? What type of restaurants they have, if they can look it up. Usually online, you know, different restaurants, they have books, travel books that'll tell you if you have restrictions, or you are a Jewish faith and you need to go only to certain restaurants that separate the meats and the dairy and so forth. That is now widely available. But you need to make sure that you understand what your restrictions are and don't put it on some other person or the restaurant, making sure you ask the right questions. If you're a diabetic, then what are your restrictions as far as carbohydrates and so forth? And then ask how things are prepared. Go to restaurants that offer different foods, not just fried chicken or not just pizza, but that they would offer different things that you can eat, just in case the rest of the family can eat anything. But and if you can't, at least the variability of different menus that they offer, so that you can choose something healthy. Now, if you're going to a country that doesn't speak English or your native language, and then you want to make sure you have something available that you can help translate, you know, on your phone, or look up the restaurants or call up the hotel ahead of time. Even in the airplane, you can choose a menu beforehand, before you even fly, and you can select menus. I think they still have that. So there are different ways you can approach it, but I think getting knowledge is very important beforehand, before taking off,
Yeah.
whether it's via the internet, the bookstore, um, you know, dietitian, your clinician. Just gather as much information as you can before you take the trip.
Yeah, yeah. So basically, do your research before
Yes.
taking that trip, to find out, to reiterate what you said, to find out what's available in that region. But also, I think I heard you saying it's important to know what your restrictions are.
Right,
And
you have to know that if you can only have a certain number of grams of carbohydrates, or if you're on dialysis, which is even worse, I mean, what can you do? I mean,
yeah,
how much, you know, how much potassium or phosphorus and so forth. Now, if you're just trying to cut down calories, then kind of know what are the healthy options you can choose.
yeah. Okay, got it. That's really helpful. Um, Now, do you also, you know, when traveling and for the sake of wellness as well, you know, we have individuals go to different programs, wellness programs, health and wellness programs, and they institute all around the world, and they institute various different types of dietary measures. Um, and some with supplements and different things like that. Do you suggest an element of caution if you have particular dietary needs, dietary restrictions, um, Do you suggest, you're similar, what you just mentioned, inquiry? I mean, obviously going to these wellness surgeons or spas or whatnot certainly have other overall benefits to decrease stress and weight management or whatever your reasons are for going. But they also implement certain dietary compliance, which may not necessarily be in tune with whatever your dietary
Right.
needs are.
Yeah. So I think the first step would be finding out what type of, I guess I would call it, mindset you have, or how your brain works as far as towards, let's say, weight. Like, are you the type of person that can be given maybe a bit of a structure or modification, and that's all you need as to eat healthy, being taught to eat healthy, and what you should, some of the things you should probably avoid, implementing exercise, because that's important. But 80% of what you do is what you put into your mouth. So, but there are other people that need very strict, they need, unfortunately, maybe weighing their food because their brain doesn't work, like just be given something, some guidelines. They need a lot more structure. So you can be, and there are little certain questionnaires you can even take to determine whether you're a person that needs very strict structure, like even structure where they weigh their food and they weigh you. Otherwise, your brain just doesn't follow it. Or whether you're kind of in the middle, or you can do it on your own. You have more of that willpower. So I think first thing is determining which person that you are, how you work towards that. And once you do that, it'll be easier to determine where you can go. Because sometimes you could go to the best spas or the best anything, but if it's not how you can work with it, then it won't work. You'll be going. People go to them 4, 5, 6 times because it's not how they're able to modify and long-term do it. They need something really structured. So it really depends on the person. We're not all the same.
Got it. Got it. Switch gears a little bit. Now, so far as, obviously everybody is different. Every person has their own medical needs, and we certainly are not in the business of giving medical advice, recommendations. And as far as our organization, we prefer people to go to their clinician and get that sort of thing, prescriptive recommendations, particularly to their needs, because we all aren't the same. Even if we have the same diagnosis, we're not the same from the metabolism and whatnot else standpoint.
Yeah, and I think a lot of many doctors don't understand that. They kind of give the same prescription to everybody. You have this, and then you have to do this.
Yeah.
But people differ, so they have to maybe try to understand, since they're different, how you can approach it to that person. So I think many clinicians do, here's your pill, to everybody that is in that same diagnoses. And I don't think that it should be the case. I think they need to approach it as to learn a little bit about their history, their background, how they've approached it in the past, what they have done in the past. Has it worked, not worked, and what can they do to figure out, there's, like I said, questionnaires, there's books, and PhDs that have done all these things. Where do you fall? How do you learn how to change your eating habits? Do you learn it this way, or this way, and then proceed?
Yeah, and that's excellent. And then too, the issue of cultural awareness and cultural competence. Okay, any tools that you can give to a clinician for asking the right question? So a lot of times, obviously, there are some people that will give you just talk and tell you their whole life story in 2 seconds. Okay, but oftentimes that's generally not the case. And as a clinician, you have to really be able to ask the right questions and ask the appropriate questions. Um, and in particular, in certain cultures, they may not tell you all the different herbs and the different grandma's, great great grandma's tradition to treat diabetes or to treat the cold or to treat whatever. They may not tell you that in their religion you are supposed to, these are the things that we do in our religion. There's lots of different sort of wellness type of traditions, whether it be something Ayurveda, different types of things, and different cultural backgrounds, Caribbean, South Central America, some of the Asian population, so Indian, Native Indian. So when you're seeing these kinds of people, unless you are aware, I would think, that there are certain things that folks do on a regular basis that, quote, is normal for them and is not an issue. It's not something that's unusual or discussed, but it may be unusual for you as a clinician because these aren't everyday things that you encounter. So,
Right. You have to be open, I think, to be open and be flexible, because obviously if they tell you something that you believe as a clinician is not good, you can't just say no, that's horrible, because you have to be open to discussing it and maybe teaching them how to modify what they already do instead of just totally just say it's horrible, no, don't do what your great grandmother used to do. And in a lot of cases it actually is positive.
yeah.
And they do have very helpful things that maybe more people should do. So it just depends on what it is and maybe who, maybe a friend told them. But if it's a lot of times what grandmother used to do actually is beneficial. So
Yeah.
I would just be more open and flexible. And I know, at least now clinicians don't have much time. They may have only 5 minutes and that's it. And they're not going to be able to discuss and more than that with the patient. So I would say, I mean, now there's all these other like functional medicine and so forth that they do spend more time, but unfortunately they're expensive. And they try to, and there's so many questionnaires, but I think each person, instead of just trying to find and give all their, I guess, put it on the clinician, they need to investigate on their own and kind of intuitively also know their own body. Like, what is it telling them? Because the sickness is, whatever you have is telling you something's wrong and you need to figure out. And it's not, and a lot of times it's just my heart or it's just my pain, but it all works together like a symphony. It all works together. So you need to back up and say, why is this something, not, I won't mention it, but not, I mean, is it stress? What, is it genetic and brought upon by, they're doing wonderful studies, even with Holocaust survivors, that generation after generation, genetically, it's to great-great-grandchildren, whatever traumas the Holocaust survivors had. So it's just a lot of different information that's every year, 2 years, it's changing. We have wonderful information. So I think people need to understand their health also, not to put it on the clinician.
I think that's key because a lot of times some cultures, they may feel, I mean, it's not necessary, but they may feel embarrassed to say certain things to their clinician because they may feel that the clinician is going to judge them in a negative way, possibly, if you doctor or clinician knew that I was taking all these other things and doing all these other things. So that sort of confidence, which is hard as a patient to bring to a physician who may not necessarily have, like you say, 5 minutes to talk about things. So they may not necessarily take the time to do this investigation, which can be very detrimental because I don't have to tell you, and maybe you can expound, but there certainly are certain non-traditional methods of healing that are done that could be that could counteract medications and treatments that are recommended by the physician. side effects and things that can occur, you may, as a physician, you may not know where they're coming from because
Correct.
they may not have been as open with you. And then it may not be because they don't want to say, but they may not necessarily feel comfortable telling the clinician all their other things that they do for that sense of feeling of being judged, possibly. So, do you think that this is really an avenue where physicians need to be, one, aware of their deficits and their deficiencies in this region, in this area, sorry, of discussion, that being nutrition, dietary, cultural awareness, compliance, and maybe there is a need to incorporate dietitian, nutritionist, that sort of thing into their practice, particularly in these kinds of not your average patient. And I don't necessarily want to say that, but we all have our various different quirks and things that we like and we do and that we've handed down from great-great-grandma. But there definitely is that cultural variation. I mean, for example, in different populations, even within the United States, American Indians, very underrepresented in the
Yes.
healthcare environment and very misunderstood. And an area that we need to, an area or region and a people and a culture that we do need to comprehend in order to treat folks. Folks may not necessarily, quote, look that way, but maybe their mom is very traditional Indian, Hawaii, different Asian populations. Again, these things are very important. So do you feel that there is an alliance? And you've mentioned forms and things. Hopefully you'll maybe share with us some links or some way that these forms can become available, and we can certainly put those as part of as part of this video as well, for people to get a hold of where this kinds of information is. Outside of having a relationship with a dietitian and a nutritionist, is there somewhere else that clinicians and even patients can go to educate themselves about things like this?
There are quite a few functional medicine PhDs that have worked on as far as this type of questionnaire, is to first find out how you view food. First of all, how do you, because each, that we don't all view it the same, and then culturally also bring that in. Like I said, it just depends, because there are even people within the same culture, like even in India, different castes eat differently. And when they change to eat differently like the other caste, it doesn't work for them. Right. Or like genetically, maybe in an island they've grown up and they're genetically they're able to digest and be healthy on their food, but they move somewhere else, they can't eat that they get sick. So
nuances you have to appreciate.
Right, you have to be pretty open.
Yeah. So we have a few minutes left in our interview. Are there any, we have about more than 5 minutes left. So are there any tips, healthy tips that you can give to healthy dietary nutrition tips that you want to share with the audience?
I mean, I guess it depends on what their goal is. If their goal is maybe they're to lose weight, then I would say to examine and see how many carbohydrates, or some people just know it as starches, like rice, potato, all that. How much are they eating? And look up what a serving size is. Mm-hmm. And then see how much they're eating a day. Because a lot of times when they write it down, and there's a neat, it's chronometer, I believe, they can put down what they eat and it'll give them, it's an app on, I think you can start it on your computer, but it also can be on the phone. And they could see if they're devoid of certain vitamins or they're eating too many carbs. They could also put their exercise. So they can kind of see, because a lot of times people will write something down and they'll be flabbergasted that they're eating 10 carbohydrate servings a day.
Yeah.
and they only need maybe 3.
Right.
So, and that's a lot of times they, they want to give serving sizes the same. Let's say 5 to everybody, and
Yeah.
we're not all the same. We're different sizes and weights, and we do
It's
different
important to know what,
activities.
right.
Right. So people are different. So you have
Right.
to see, and a lot of times that's really quite interesting when they just see, okay, I'll write down what I'm eating, being honest with themselves. A food journal, food diary, they could write down 2 or 3 days and the amounts, the portions, the times. You don't, and for a long time they're saying you have to have breakfast, but I've noticed that people maybe, a lot of other cultures maybe have dinner like at 9 o'clock.
Right.
And a pretty heavy dinner. And so in the morning, they may not want breakfast, not because they want to skip breakfast, but they're still fur from the night before. So seeing what your hours are, and you don't have to have 3 meals if you've had 2 big ones. You don't have to have as many snacks as they say, have 3 meals and 2 snacks, because maybe that's too many calories. So
Right.
I would say tailor it more to yourself. How are you eating? What your needs are? What your goals are? So seeing how many carbs you're eating, I think that's where a lot of people, their weight comes from eating so many carbohydrates because it's very easy.
Yeah.
And it doesn't necessarily have to be expensive to eat healthy, because there's lots of vegetables you can get, homegrown vegetables. That should be about half your plate is the vegetables.
Right.
And even for me, sometimes it's hard to eat that much, so you can juice it or bullet, the vegetables in there, and you can get like 3 servings in there, and you don't have to worry so much about 2 more or 3 more during the day. So there's a lot of little things, little tricks you can do that you don't have to eat so much. Size, anything you'd like to do. Sometimes people say, well, I don't like to do this, I don't like to do that. And I said, well, do something you like, whether it's walking or dancing. A lot of people are into Zumba now. So if that's what you like, but do something you like that you'll do long term.
Excellent. Okay, this has been very helpful. And I want to thank you for being so, for explaining things so well. We've talked
Well, thank you for
about,
having me.
oh, absolutely. We've talked about foods and dietary needs, compliance, and the importance of cultural understanding, cultural variation. We've talked about traveling and maintaining your diet, and then some healthy tips that you've given us. And I think that's going to be very helpful for our members and our clients and those who are tuning in to our show. And we want to ask everybody to take a moment to subscribe to our channel. So right below there's going to be a little button that you can subscribe, and you'll get all our other videos. We'll have a lot more videos coming as it relates to health and wellness, and as it relates to travel, and take a look at some of the things on our website as well. Shaw Medical Travel Consultants. I'm Dr. Judy Shaw, and this is Liliana Aguilar. And thank you.
Thank you. Have a good day.